Hello, my name is Mackenzie Spell, and I have just received a report on my patient. Today I'm taking care of Mr. Leon. He is a 32-year-old male here in the office today for a follow-up visit regarding acid reflux. He's not currently taking any medications, and he is allergic to Rocephin. The patient has a medical history of anxiety, ADHD, and a strong family history of GERD/erosive esophagitis. He smokes 1 pack per day of cigarettes. He does not drink alcohol, and I will be providing education on his condition and the medication that the doctor has prescribed him today. Hello, Mr. Leon. My name is Mackenzie, and I'm going to be your nurse today. Can you tell me your date of birth?
Yes, it is 2/26/1993.
All right, thank you. Okay, great. So you've recently been diagnosed with GERD. What this means is stomach acid is flowing back up into the tube in your throat, which is your esophagus. The backwash is referred to as acid reflux. When this happens repeatedly over time, this can lead to GERD.
Okay, the doctor did go over some of this during my appointment. I have been experiencing heartburn lately.
Heartburn is one of the most common symptoms of GERD. Does this happen often after you eat?
Yes, and it seems to be worse at night when I lie down for bed. What are some of the other symptoms I should look out for?
So GERD can cause a variety of different symptoms, but some you can experience are upper belly abdominal pain, chest pain, trouble swallowing, feeling like you have a lump in your throat, like you need a constant feeling of like having to clear your throat, and an ongoing cough.
Well, thinking about it now, I have had this annoying cough for a while, and sometimes I feel like I cannot swallow good. So can I ask what has caused me to develop GERD?
So like we said, the stomach acid is flowing back up into your esophagus from your stomach. This is because at the bottom of your esophagus, you have a circular band of muscle called a sphincter. The job of this muscle is to relax, which allows food and liquid to flow into your stomach. Then it will close again. What happens in GERD is the sphincter does not relax, or it weakens, causing acid to backflow into the esophagus. This essentially is what causes the irritation in the lining of your throat.
Is there anything that can make this better or worse?
So it's important to stop smoking. As we talked about, you currently smoke about 1 pack of cigarettes per day. Also eating fatty foods, fried foods, eating a very large meal at a time, or eating very late at night and then you go to lay down and go to bed. Alcohol consumption or a lot of caffeine can also irritate GERD.
So what is the complications from this if it's not corrected?
So some complications can include esophagitis, which is the inflammation of the lining of the esophagus. This can cause bleeding and ulcers to develop. You can also have narrowing of the esophagus due to scar tissue buildup from the excessive acid backwash production. This can make it difficult for you to swallow. It also puts you at an increased risk for esophageal cancer, a condition called Barrett's esophagus, which basically what it is you're developing abnormal cells like precancerous cells in your esophagus due to the acid taking away the healthy tissue, and then it leaves more opportunity for unhealthy tissue to grow.
Excuse me. Well, thank you for answering my questions. So what are my next steps?
So at this point in my education interview with the patient, we're going to move into medication management, treatment plan, and what are our goals for this patient. So my goal for this patient is the patient will report a decrease in GERD symptoms such as heartburn and difficulty swallowing to no more than 2 episodes per week by the end of 1 month. My assessment would be assessing the patient's pain and symptom decline at his follow-up appointment. Would be discuss with the patient lifestyle modifications such as changing his diet, smoking cessation, and making sure he takes his medication like he's supposed to. I will educate the client on the medication side effects, some things to look out for, how long it will take the medication to work, and things to report to the doctor if he has any further questions. So our next steps would include the doctor wants to schedule you for an upper endoscopy. So basically what this procedure is you'll come into the office, they put you under general anesthesia. He's going to take a camera, go down your throat, look at the lining of your esophagus, see if there's any bleeding, any scar tissue, or any ulcers, some of the complications that we spoke about earlier.
Yes, he went over this procedure with me during my appointment, and he told me I will be scheduled for this next week.
Great. So the doctor is also prescribing you pantoprazole, 40 milligram tablets, and he wants you to take one tablet twice a day. I would recommend taking one tablet in the morning before breakfast and one tablet at night before dinner. Just so you know, this medication can cause you to have a headache, some abdominal discomfort, nausea, vomiting. It can cause diarrhea, and it can cause erectile dysfunction in men. So if you experience any of these negative side effects, please call us and let us know. Okay. The medication should start making you feel better within 3 days, but it can take up to 4 weeks to fully control your symptoms. So don't get discouraged if you're still having some breakthrough episodes within the first couple of weeks.
Okay, thank you. I will pick this up from the pharmacy on the way home.
You're welcome. Make sure you schedule a 1-month follow-up appointment with your doctor so we can monitor your progress with the new medication. Can you tell me how you will take your medication?
I am taking pantoprazole 40 milligram tablets twice a day, one in the morning before breakfast, one at night before dinner. I am also scheduled to have an upper endoscopy next week.
Fantastic. Do you have any further questions for me today?
No, ma'am. Thank you so much for your help.
You're welcome. If you have any further questions, please call me at the office. Have a great rest of your day.
You too. Thank you.
So that concludes my teaching session. A few key points that I want to hit is I did use the teach back technique with my client as I explained to him how to take the medication, and then he was able to accurately relay that information back to me. I also will continue to monitor his progress. Right now, his SMART goal would be in progress as he has a 1-month follow-up appointment from today's visit. So we'll see if his treatment is effective. I also went over the pros and cons of the medication, the side effects, things for him to look out for. The doctor did explain to him informed consent with his upper endoscopy, but I reiterated those concerns and asked him if he had any further questions. I hope this video gave some insight onto nursing education. Thank you.